Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is the adaptive immune system, to follow on from our previous episode, which was on the innate immune system, so do look back at that if you haven't watched it already. So what is adaptive immunity? So in contrast to the innate immune system, this is specific and targeted and is part of the defense mechanism against pathogens. It's important to remember that this is only found in vertebrates and is subdivided into cellular and humoral systems. So the key features, if you remember nothing else, is that it's specific and it produces memory. So looking at the humoral system first, this is a form of circulating immunity. The humoral system encounters a pathogen which then goes on to produce memory cells. B cells, specifically, produce antibodies for specific pathogens. Pathogens can evade the humoral response by hiding inside cells. So, for example, this is seen with certain viruses. Therefore, a cellular system is also required. With regards to the cellular system, human leukocyte antigen, or HLA, are involved. Cells use this to express intracellular contents on external surfaces of the cell. HLA presentation is encoded on chromosome 6 in the major histocompatibility complex, or MHC region. There are two main forms of HLA. HLA class 1 is recognized by CD8 positive T cells on most cells except the red blood cells and trophoblasts. HLA class 2 are recognized by the CD4 positive T cells on antigen presenting cells, which we talked a little bit about in the episode on innate immunity. Most cells express HLA class 1, also known as the housekeeping HLA. A few antigen-presenting cells have HLA class 2, and these are part of the innate system, which phagocytose extracellular material so it can be expressed. T cells interact with HLA to determine if expressed peptides are self or non-self. So let's now discuss this in a question. A 40-year-old man experiences recurrent infections with intracellular pathogens. Immunophenotyping reveals a reduced count of T lymphocytes, expressing the CD8 co-receptor. Which aspect of the adaptive immune system is likely compromised, affecting the patient's ability to mount effective responses against intracellular infections? I'll just leave that up for a little bit longer. It's quite a lengthy question. So our options are antibody production, memory T cell formation, cytotoxic T cell activity, B lymphocyte differentiation, or helper T cells. So in this question, it's important to remember the process of adaptive immunity and the steps involved in this. Given that in this case, there is reduced counts of cells expressing the CD8 co-receptor, the correct answer in this case is the cytotoxic T cell activity is most likely affecting the patient's ability to mount an immune response. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.